Dr. Dennis Lox, Sports and Regenerative Medicine. Today we're going to talk a little bit about knee AVN. And don't forget to like this video so other people can help understand this. Avascular necrosis is when the blood supply to a bone becomes disrupted, and the loss of blood flow causes bone cell death. Hence the term avascular necrosis, or often terms it's called osteonecrosis. The hip is the most frequent joint, but I have seen just about every type of AVN in every joint. And following the hip, the shoulder is next frequent, and then the knee. So we're going to talk about a patient who had systemic lupus erythematosus, SLE or lupus. It's an autoimmune disorder, and they're predisposed to having avascular necrosis. One of the treatments for these autoimmune diseases is sometimes corticosteroids, and high-dose corticosteroids can actually precipitate avascular necrosis. So it's kind of a more complicated phenomena and increased risk for that. So this particular patient had both, lots of corticosteroids and had lupus, so double risk factor. So this is an MRI of the knee. So the knee joint is comprised of the thigh bone, the femur, and the shin bone, the tibia, and the articulation between it is where the meniscus and the joint separation is. So here's the femur bone. The area that becomes necrotic, where the dead bone is reflected on an MRI as a dark spot. And you can see it here, and on the other scan you can see this dark cystic-like lesion. This is the area of avascular necrosis. So the problem with AVN is that over time, if it isn't taken care of, it tends to collapse. And once it collapses, that bone is on bone, and it has a rapid degeneration or destruction of the joint, which we don't want to happen, because that ends up leading to knee or hip replacement. So our goal with the regenerative medicine stem cell therapy is to try to prevent that. In younger patients, we can actually repopulate some of that bone and actually get it to look more normal, which we've done with some teenage athletes and got them to go on to have collegiate scholarships in their sports. So this is a tremendous opportunity with regenerative medicine to help these people. One of the most famous athletes of all time, the legendary Bo Jackson, had avascular necrosis of his hip from a traumatic football injury, and it ended his career. He played one season with the Kansas City Royals in baseball. But avascular necrosis can have a very disastrous course of events for an athlete if it isn't treated early. And so that's what we're trying to do with this, is try to prevent the long